Welcome to the Tim Booker channel, where wisdom is worth spreading. Wishing you a delightful listening experience. Today, we're delving into the truth behind Bottle of Lies. We often hear the saying, you get what you pay for. But in the pharmaceutical industry, it turns out that cheap can also mean good quality. That's where generic drugs come into play. These drugs have the same efficacy as brand-name drugs developed by pharmaceutical giants but come at a significantly lower price. When a pharmaceutical company develops a new drug, it enjoys around 20 years of patent protection. Once that period expires, other companies can legally produce generic versions, causing the price to plummet. Generic drugs are immensely popular, especially in the United States, where, in 2017, they accounted for 90% of the prescription drug market. So, you might be wondering, which country plays a pivotal role in driving this industry forward? Is it the United States, the largest consumer of generic drugs worldwide? No, it's not. What about Japan or Germany, with their advanced pharmaceutical giants? Still not there. So, who is it? India, often referred to as the world's pharmacy, is the major force behind the generic drug industry's growth. Take anti-cancer medications, for example. Nearly all mainstream anti-cancer drugs have generic versions in India. The domestic generic drug industry in India began booming as early as 1970. Since then, they've expanded their product reach to regions like Africa, Latin America, North America, and Europe. By 2012, India had become a pharmaceutical export powerhouse. Why India, and not a more advanced, developed country in the pharmaceutical sector? This book can answer that question. The author of this book is Katherine Eben, a seasoned investigative journalist from the United States. To investigate the generic drug industry, she embarked on a decade-long, in-depth investigation, traveling to 4 continents and reviewing a vast amount of data to write this book. Let's start by exploring how the Indian generic drug industry rose to prominence. The author believes it's related to a local saying in India, we don't build systems, we find ways around them. If you know India, you might nod in agreement. In India, most formal systems are ineffective, and even buying movie tickets may require turning to the black market. Following the rules and regulations doesn't often yield favorable results. Therefore, locals have developed a practice called jugaad, which means finding the shortest path to accomplish a task, avoiding the cumbersome parts. For instance, let's take Gleevec, a specialty drug for treating leukemia produced by the Swiss pharmaceutical company Novartis. A branded version of Gleevec costs over $4,100 per bottle, whereas an equivalent Indian generic drug, Vnat, is priced at only $130. This isn't an isolated case. For a long time, some generic versions of cancer drugs were available only in India and nowhere else globally. Why is that? It leads us to India's flexible patent policy. They have a very lenient approach to patent protection for drugs, encouraging Indian companies to research and export generic drugs. Before 1970, drug prices in India were actually quite high and even exceeded those in Europe. This made healthcare unaffordable for the poor, leaving them without the same treatment opportunities as the wealthy. A crucial turning point occurred in 1970 when India passed the Indian Patents Act. Under this law, they only protected the process of manufacturing drugs, not the drug's composition. In other words, as long as the formula was altered slightly, Indian pharmaceutical companies could replicate any drug from any country. This patent law benefited the masses, giving access to affordable medicines, while also granting Indian pharmaceutical companies the freedom to innovate in drug production. Local generic drug companies started thriving, producing whichever drugs were effective and unaffordable to the poor. Of course, this triggered strong protests from multinational pharmaceutical companies, many of which withdrew from the Indian market altogether. If we look at it from their perspective, this patent law severely damaged the interests of companies investing billions of dollars in over a decade in research and development, only to have their market share taken away by cheap Indian generic drugs after a few years. But does a noble motive justify enforcing strong-arm laws? Well, the Indian government invoked compulsory licensing provisions in patent laws. The primary aim of this provision is to allow poor countries to import affordable drugs during major outbreaks of infectious diseases, especially when they lack the capability to manufacture these drugs themselves. For example, Some African countries severely affected by the AIDS epidemic imported antiretroviral drugs at very low prices, and many of these drugs were produced by Indian generic drug companies. Did the companies whose drugs were forcefully replicated have any recourse? Not really. For example, Novartis battled the Indian government in court for over a decade regarding Gleevec's patent, ultimately losing the case. There are numerous controversies surrounding India's patent law, but we won't delve into them in detail today. In summary, this law marked the golden era of the Indian pharmaceutical industry, transforming local companies into skilled artisans in the field of generic drugs. Today, this book introduces a major Indian pharmaceutical giant called Ranbaxy Laboratory Limited. Through the experiences of this company, we can gain a better understanding of how Indians excel at finding the shortest paths to solving problems. Ranbaxy was once a legendary presence in India, and it was because of them that the world began to take notice of the strength of Indian businesses. However, in its early days, Ranbaxy didn't have the capability to manufacture products independently. They would buy raw materials from elsewhere and transform them into pills and capsules. Ranbaxy, with no foundation in drug development, later became a giant in the world of generic drugs, all thanks to their approach of, we don't build systems, we find ways around them, and their knack for adaptability. Let's delve deeper. Firstly, at a personal level, the owner and core employees of Ranbaxy were adept at adaptability. In 1961, a man named Bhai Singh founded Ranbaxy, and he knew how to achieve business success within India's system. For instance, he successfully cultivated government ministers and bank executives as his confidants. He even had someone report illegal activities of his business partners, then acquired shares of that pharmaceutical company. His son, Parvinder, was also skilled at taking shortcuts. In the 1980s, Parvinder aimed to transform Ranbaxy into a global enterprise, selling drugs in the United States, the world's largest market. However, at that time, nobody outside of India had confidence in Indian pharmaceuticals, and no Indian pharmaceutical company could sell drugs in the US, given its stringent regulations. Parvinder went to the United States and formed alliances with some Americans, finding a way around. He got acquainted with a chemical import trader who was a significant donor to the U.S. Democratic Party and had a close relationship with the later U.S. President Clinton. With this trader's assistance, Parvinder successfully introduced Ranbaxy's drugs into the U.S. Besides the owners, Ranbaxy's researchers were skilled at adaptability too. Although developing generic drugs isn't as challenging as creating new drugs, it's still no walk in the park. In essence, generic drugs must replicate the efficacy of brand-name drugs without replicating their manufacturing processes. Ranbaxy's researchers addressed this challenge through reverse engineering of drugs. In simple terms, reverse engineering involves analyzing brand-name drugs to obtain crucial information related to their formulation and manufacturing processes. Then, they found ways to produce products with equivalent therapeutic effects. Ranbaxy had a formula genius who held over 60 patents in reverse engineering. If any laboratory discovered that a drug had lost its efficacy, they would quickly bring him in to solve the issue. Why does India have these formula geniuses? The book mentions a theory by an Indian scholar who suggests that due to their exceptional engineering memory and experiences of poverty, Indian scientists excel at rethinking old procedures and making them more efficient. In other words, these Indian formula geniuses are adept at finding clever ways to work, discovering the shortest paths to problem solving. With the help of these talents, Ranbaxy could produce drugs at lower costs to serve more people. However, for companies like Ranbaxy and other Indian pharmaceuticals, producing generic drugs was only the first step. Selling them was another challenge because the world had long held biases against Indian generics, viewing European and American pharmaceuticals as innovative and Indian ones as imitators and counterfeiters. Some African doctors even referred to Indian generics as cat urine. How could this bias be overturned? Ranbaxy had always struggled with this issue, but they didn't go the typical route of imposing strict penalties or relying on product quality to change perceptions. Instead, they continued to rely on adaptability, waiting for an opportunity to change the game, ideally one that would capture global attention. For example, in 2001, the United States was in a state of panic due to the anthrax scare following the 9/11 terrorist attacks. There were very few antibiotics available to treat anthrax infection. One of the drugs produced by the pharmaceutical giant Bayer was effective but cost nearly $2 per pill. Ranbaxy offered the same drug at 1/5 of the price. However, the US government didn't purchase Ranbaxy's generic version. The turning point came on November 21, 2003, when then US President Clinton visited Ranbaxy's headquarters. He publicly thanked Ranbaxy and other Indian generic drug companies for supporting African nations by producing low-cost anti-HIV drugs. Ranbaxy's prices were indeed low, selling a day's worth of anti-HIV medication for only 38 cents, significantly cheaper than the cheapest generic alternatives. Clinton's visit not only boosted Ranbaxy's sales but also improved their reputation and changed prior biases. With the endorsement of a US president, Ranbaxy appeared incredibly benevolent, as if standing alongside angels. Ranbaxy's executives would say, "We don't make much money by selling cheap anti-HIV drugs. It's out of a sense of social responsibility because we are based in developing countries, and we witness the problems of these nations as soon as we step outside our doors." Through India's lenient drug patent policies and their adaptable approach, Ranbaxy achieved business success. In 1995, Ranbaxy received approval from the US Food and Drug Administration, FDA, becoming the first Indian pharmaceutical company to manufacture drugs for the US market. By then, Ranbaxy had already become a multinational pharmaceutical company, with 80% of its sales coming from overseas. You might have noticed that earlier, when I introduced Ranbaxy, I said it was once a legendary presence in India. Why do I say, once? That's because in 2014, it was acquired by another Indian pharmaceutical giant, Sun Pharmaceuticals. How did a legendary company end up being acquired? The reason is still that Indian saying, "We don't build systems, we find ways around them." Ranbaxy also found a way around regulatory systems. For many years, this Indian generic drug giant engaged in widespread fraud, and the generic drugs they exported worldwide posed safety risks. So, here's the question: how did a pharmaceutical company involved in such significant fraud manage to obtain FDA certification? In the eyes of many, the FDA represents the highest standards. In the book's words, if a product receives FDA approval, it's equivalent to global acceptance. For years, people around the world reached out for Ranbaxy's generic drugs without hesitation, knowing that while they were inexpensive, they had been certified by the FDA and therefore were presumed to be safe. Next, let's take a closer look at how Ranbaxy managed to navigate the FDA's regulatory system. They primarily exploited two vulnerabilities. The first vulnerability was within the FDA's regulatory system itself. A health expert once compared FDA regulation to the difference between an advanced Boeing aircraft and an old bicycle. Even the most advanced Boeing aircraft has limitations. The FDA is responsible for regulating approximately 1/5 of economic activity in the US, but conducting comprehensive inspections of products isn't feasible. Moreover, the drug manufacturing process is complex and prone to problems. To put it simply, wherever there's a step in pharmaceutical production that can go wrong, it invariably does. So, how do drug manufacturers ensure product quality? The only way is by strictly adhering to production rules, continuously recording each pharmaceutical step in real time, and using this data to detect and correct inevitable errors. In this scenario, the FDA requires companies to conduct self-inspections, which put a significant emphasis on a company's corporate culture. Some pharmaceutical companies excel at self-inspections, such as Merck. If they suspect the quality of a particular batch of drugs, they discard the entire batch. But how many companies follow this approach? A high-ranking executive from a generic drug company once told the author confidentially that there's a vast gap between the regulatory expectations for generic drug companies and their actual behavior. According to a former FDA investigator, if regulatory agencies don't conduct investigations, these companies won't self-inspect. The former CEO of a major U.S. generic drug company even mentioned that the U.S. turns a blind eye to foreign pharmaceutical companies. If you're a foreign drug company, and the chances of getting caught are close to zero, what would you do? Let's see how Ranbaxy exploited this situation. First, let me explain how foreign generics can get FDA approval. While the U.S. regulatory system is strict, it has created a fast track for products like generic drugs that can improve the lives of impoverished populations. Pharmaceutical companies only need to conduct some tests to demonstrate that their generic drug is biologically equivalent to the brand name drug and can perform a similar function in the human body. Biologic equivalence means that the generic drug releases the active ingredient into the bloodstream at nearly the same rate and extent as the brand name drug. FDA has defined a range for this equivalence. The generic drug's blood concentration should not be less than 80% of the brand name drug's concentration, nor higher than 125%. To ensure the safety of generic drugs, companies occasionally need to slow down or stop on this fast track. Strict adherence to good manufacturing practices is akin to traffic signs and speed limits on this route. However, Ranbaxy sped through this path, going around traffic signs whenever they encountered them. In the application process, Ranbaxy submitted falsified data, claiming that their drugs were biologically equivalent to the brand name drugs. During testing, they simply ground up brand name drugs and put them into capsules, pretending they were their own. In the production process, they manufactured low-cost drugs without safety guarantees and sold them worldwide. In the author's words, Ranbaxy was most skilled at producing not generic drugs but rather falsehoods. At this point, you might wonder how Ranbaxy got away with it, and what about the FDA's reputation for being the strictest regulator globally? It turns out that the FDA had its own set of challenges. They realized that relying solely on self-inspections wasn't practical. The best way to ensure pharmaceutical companies adhered to the rules was to conduct surprise inspections when companies least expected it. FDA sent investigators to factories unannounced. In the US, this was standard practice. FDA investigators could enter any part of the factory without notice, similar to a SWAT team raid. All they needed was to show their badges, and they could inspect every corner of the factory. They could stay for as long as they wanted, and if the factory refused inspection, it could be shut down. If investigators found significant production defects or safety hazards, the company had to address them immediately or face penalties. Foreign generic drug companies that wanted to enter the US market had to accept these inspections as well. However, when it came to foreign inspections, Ranbaxy found another gap. This was because FDA inspections overseas followed a different set of rules. Investigators couldn't conduct surprise inspections, they had to announce their visits in advance. They had to request invitations, obtain visas, and enter the factory with the company's cooperation. Even when investigators went overseas, their inspections could only last for 7 to 8 days. To maintain friendly diplomatic relations and avoid international incidents, investigators had to adhere to the principle of non-confrontation. They needed to inspect the factories in the presence of company staff. Moreover, the FDA had no enforcement authority in India. Even if investigators found issues during the inspection, they couldn't effectively regulate foreign pharmaceutical companies. Ranbaxy had its headquarters and many factories in India. In this overseas inspection system, FDA investigators visiting Ranbaxy were more like guests than surprise inspectors. In this performance, Ranbaxy played the role of the host, while FDA investigators were invited guests. Hosts rehearsed meticulously, cleaning floors, equipment, organizing documents and data. They even hired a consulting firm to review everything in advance. In short, they ensured that everything that guests might see was meticulously arranged. Ranbaxy factory employees were also well trained. They received training not on how to safely manufacture drugs but on how to confuse the investigators who came to inspect. When investigators arrived, they would conduct document checks to see if the factory adhered to regulations. Once, several Ranbaxy employees wrote earlier dates on documents and placed them overnight in a humid room to speed up aging. All of this was designed to deceive the investigators. When investigators visited Ranbaxy factories, trying to uncover any wrongdoing felt like trying to catch a mouse by tiptoeing. In theory, this cat-and-mouse style inspection, which should happen approximately once every 2 years for an overseas factory, occurred much less frequently, sometimes once in a decade. The FDA had its own challenges. Overseas pharmaceutical factories were numerous, and from 2002 to 2009, the number of overseas factories requiring inspections by the FDA increased from 500 to 3,000. An investigator mentioned, "The responsibilities tied to us have exploded like an explosion. Our burden is immense, and the resources aren't truly allocated properly." Additionally, FDA overseas inspections weren't mandatory, investigators had to volunteer to participate, so how was this massive scam exposed? The key figure in all of this is the protagonist of this book, Dinesh Thakur. He was a former employee of Ranbaxy, a person who followed the rules and wasn't adept at improvisation. Thakur, an Indian American, had previously worked as an information scientist at a pharmaceutical company in the United States. He left the US with the hope that Ranbaxy would become the Pfizer of 21st century India. After becoming the information architect at Ranbaxy, he gained access to the company's global market information and discovered the fraud within. Initially, Thakur believed that these fraudulent activities were happening from the bottom up. He believed that a leading multinational pharmaceutical company like Ranbaxy wouldn't be as corrupt as India's public sector. He and his team began collecting evidence of Ranbaxy's fraud and presented a report to the CEO, hoping to rectify the situation. However, the initial reaction of a board member upon seeing the report was to turn to the CEO and ask, "Can't we just hide the data?" It became evident that this scam had penetrated Ranbaxy from the top down. Ranbaxy's executives pressured lower-level employees to allow defective drugs to pass. In the eyes of these high-ranking executives, profit was more important than patients' lives. Ranbaxy claimed to adhere to U.S. standards for all drugs it produced worldwide. However, they reserved the lowest quality drugs for Africa, where drug regulation was weakest, and where they believed they wouldn't be caught. During a board meeting, a doctor responsible for drug oversight at Ranbaxy expressed concerns about the quality of drugs exported to Africa. In response, a top executive said, "Who cares? It's just a matter of a few deaths." Disillusioned, Thakur left Ranbaxy. He could have chosen to do nothing, but he believed that doing nothing was a form of complicity. In India, whistleblowers aren't protected by law and face life-threatening risks. Moreover, the Singh family, the owners of Ranbaxy, were known for using threats to deal with problems, even resorting to hiring thugs to resolve internal disputes. Faced with danger, Thakur chose honesty because he saw it as the only way forward. On August 15, 2005, Thakur registered an email account. He sent emails to the World Health Organization, the U.S. Agency for International Development, and the FDA, reporting Ranbaxy's fraudulent activities. He didn't know that he had embarked on a 9-year journey of whistleblowing, nor did he know that his email to the FDA would uncover a complex global scam. At this point, I've summarized the essence of this book's content for you. Finally, I want to address the question of whether Ranbaxy's fraudulent behavior was an exception or the norm in the Indian generic drug industry. Unfortunately, the answer the author received isn't optimistic. Fraudulent practices like those of Ranbaxy are widespread in the Indian generic drug industry. These pharmaceutical companies export their highest quality drugs to countries with strict regulation while providing the lowest quality drugs to regions with lax or no regulation. Part of the reason Indian pharmaceutical companies can establish this alternative system within the industry is that Indian regulators overlooked existing norms. Where official governance is paralyzed, flexible rules come into play. As the author in Mumbai said, in India, choosing to abide by the law can be so burdensome that people opt for the easier route. Yet, when an entire nation collectively chooses the easier path, it establishes an alternative system. That covers the key content of this book. Congratulations on completing another book, and thank you for your support and attention. Please subscribe to the Tim Booker channel, like, and share with your family and friends. Wisdom is worth spreading, and it opens the door to a brighter future. Thank you, and goodbye.